Good afternoon, morning, everyone, and welcome. My name is Jennifer Ho, the Operation and Program Manager at GFAN AP, and I will be today's moderator. Today's webinar session titled Ending TB, Overcoming Political and Financial Hurdles in the Asia Pacific. We're very pleased to see everyone here join us from across the region and globally. Today's session is jointly organized with our partners, Global Coalition of TB Advocates, Activist Coalition on TB Asia Pacific, TB People Global, Unite Global, Asia Pacific Regional Learning Hub, and GFAN AP, the Global Fund Advocates Network Asia Pacific. Thank you all for collaborating and to make this discussion happen. Before we begin, just a few quick housekeeping notes. Yeah, thank you. This session is being conducted in English. As participants, please turn off videos and mute your microphones. If you're experiencing slow bandwidth, please do close any unnecessary programs or applications on your device. Please feel free to use the public chat box to engage with one another throughout the session, and please note that this session is being recorded. And lastly, GFAN AP is committed to ensuring that this virtual event is conducted in an inclusive and safe environment and will not tolerate harassment of any kind. Participants that engage in disruptive behaviors may be removed without prior notice. Next. Before we move on to today's agenda, a reminder of today's webinar objective. First is to provide updates from Asia Pacific perspective on key expectations for Global Fund Grant Cycle 8, TB and drug-resistant TB programmings, including sustainability, co-financing requirements, and the role of country coordinating mechanisms. Second, it's to examine the implications of Global Fund replenishment outcomes on TB communities and civil societies in Asia Pacific region, particularly in relation to funding availability, program and network continuities. And lastly, to facilitate collective strategizing among participants on priority collaborations, advocacy approaches, and coordinated actions needed to strengthen donor engagement, mobilize additional resources, and support pledge conversions. And on that note, I think everybody can see the agenda. We'll keep that on. But I would like to, at this point, invite our co-organizers to please to give us a brief 1-minute welcome remark. First, I would like to invite, is Blessy here with us? I'm Blessy Kumar, the CEO of GCTA. Yes, there you are. Hi, Blessy, over to you.
Yeah, thank you very much, Jen, and thank you, Rachel. So it's my absolute privilege to say welcome to everyone. This webinar comes at the right time as we are going through a continuing crisis of funding cuts, realigning ourselves with what is available, realigning our priorities, and trying to find solutions to still work together to ensure that our united goal or a unified goal of ending TB becomes a reality. So, with many thanks to GFAN AP for organizing this and to all the partners who have joined us, welcome you all warmly. I think it'll be a very interesting webinar as we share how we have, each of us in have reprioritized and realigned ourselves to address the issues and also make things better through our country coordinating mechanisms. Thank you so much.
Thank you so much, Blessy. And just to also note, Blessy is also the chair of GFAN AP. So thank you for those welcoming comments, Blessy. Next, I'd like to invite Leslie on behalf of ACT AP to give a few words. Rachel, Leslie, are you with us? Leslie will be joining us from PNG, and I'm sorry, I do not see him with us at this point, though.
No, he's not with us. Let's just move ahead first.
We'll move ahead first then. Okay, then let me next invite. Oh, okay. So next invite, let's go with this. Otman, on behalf of Unite Global.
Yeah. Thank you so much. Good afternoon, everyone, and a warm greetings to all colleagues and partners joining from Asia Pacific and beyond. My name is Aman Shukla, and I'm representing Unite Global, a youth-led platform for young people to mobilize, empower young people, and to lead advocacy innovation to take action to eliminate TB. It's an honor for us to join hands with the partners and communities today to discuss on how collectively we can overcome political and financial challenges and strengthen our shared commitment to ending TB. Thank you.
Great, thank you so much, Otman. Next, let me please invite Chinmay on behalf of the Asia Pacific Regional Hub. Chinmay, please turn on your video.
Yeah. Thank you so much, Jennifer. So good afternoon, everyone. I'm Chinmay Kumar. I'm the coordinator for Asia Pacific Regional Learning Hub, and I'm honored to welcome you to this timely discussion. At the Learning Hub, our mission is simple. We ensure that communities and civil society voices aren't just present in the global fund processes, but are informed, influential, and leading at the same time. Our role at the Learning Hub is to help you navigate on understanding the new GC8 technical requirements or assessing technical assistance to ensure your country's funding request is truly community centered. Let's ensure today's isn't just about sharing information, it's about equipping ourselves for the advocacy ahead. And let's make this session count. Thank you so much. Over to you.
Great, thank you so much, Chinmay. And I'd like to Oya from TB People Global sends her apologies. She's not able to join us today, but lastly, I'd like to invite Rachel Ong on behalf of GFAN AP to give some welcoming remarks. Right,
Great,
Rachel?
thank you so much, Jennifer. My name is Rachel Ong. I'm the regional coordinator for GFAN Asia Pacific. A very, very warm welcome to all of you, and thank you to all our co-organizers for taking part in this really important webinar. We had planned this ahead of World TB Day, but we have decided not to do that during the week because of it coincides with many other important public holidays in our region. So we extend a very warm welcome to all of you for taking time out of your very busy schedules to engage in this very, very busy discussion. And I'm going to take this opportunity to also welcome our next speaker, who is very distinguished, and we all know her if we're working in the TB space, a very huge advocate and activist, whom I always learn so much from, Luchika Ditiu, who is the executive director of the Stop TB Partnership since 2011. And without further ado, we will welcome Luchika to give the keynote address that will focus around what the financial hurdles would be in the Asia Pacific and what the political challenges that we would see in the upcoming years as we go towards TB elimination, ending TB. Over to you, Luchika.
Thank you very much, Rachel, and thank you to all the partners that are co-organizing this event. And I will not mention everyone, but we all know each other very well for many years, for many years in this collective effort to end TB. And I'm also thrilled to have Aman with the youth here because some of us will need to pass the baton to the next generation towards in this fight. Unfortunately, I don't think that for some of us during our careers, working careers, we will see a real end of ending TB. I think we will drop down the values of the incidence and mortality, but I don't think as long as, for example, my working career will be, we will see the end of it. Now, three things that I want to say, World TB Day is coming in 2 weeks, less than 2 weeks. And unfortunately, tuberculosis remains the biggest infectious disease killer, remains a huge burden And unfortunately, it's airborne, so we are all at risk of ending TB, getting TB as long as we breathe. But unfortunately, even though we have the tools, maybe they are not perfect, but we have them, we are not making the necessary dent in this disease. With all the efforts that we are doing, we are still away, maybe not that far away, but away from ending this disease. GC8 and the funding from the Global Fund that will be announced hopefully through the letters next week comes in an overall landscape of uncertitude, of competing priorities, of very deep economic shifts, and a very, very challenging political environment. So it's is difficult, represents huge obstacles in this context to really push not only health agenda, but TB, HIV, or malaria agenda. For TB, we were never the darlings of funding. I would say that with well-known decisions were made due to political approaches. There was nothing scientific or technical that led to TB being ignored. I would say it should have been different, but the challenge we have is that in this context in which money of GC8 are less than GC7, that's absolutely clear. Overall, donors are giving less for development and health. We have for sure competing priorities at domestic level between what investments should be. The money for TB will be there from GC8, will be very little, so countries will have will have to prioritize, will have to be very mindful, and I would say that the CCMs will be challenged more than ever. And I will just say one thing about TB. In this environment, tuberculosis response comes with a lot of new tools, comes with a lot of innovations, comes with a lot of opportunities to be smart in investing in diagnostic tools that can, help decrease the cost of investigation, increase the access, increase efficiency. So we have pooling, we have near point of care, we have the mobile X-ray and the AI. There are a lot of opportunities there. It comes again, especially for Asia Pacific, on a landscape of increased visibility for TB and political will. Almost all ministers of health can freely and untriggered speak about TB and how, and the response in their country, and they approach it in a very different way than it used to be. There is increased number and the desire to engage from our communities, people with TB, advocates and activists. It's again a very different environment than it used to be years ago. Obviously, treatments and the perspective of a vaccine really at the close horizon. So it's very dramatic that in this moment of kind of blooming, or at least several opportunities, the funding will be less. The funding will be less. Countries will be asked to prioritize. And as we always know, nothing new that I'm saying here, they will go for commodities procurement. They will reflect many times before they will invest, especially in communities and civil society. In this difficult time, it's extremely important for everybody here to ensure a very strong link with the CCMs and the country programs. That's very difficult to do. Traditionally, TB had very poor representation in the CCMs, or wherever it was kind of done in countries to tick a box to say there is somebody from TB here. Very often we observed people from the academic sector representing people with TB, or communities or civil society. Very often we see that some of them don't even exist there, or that in a CCM of tens of people, there are one or two representing TB. So, but this will be very important. This engagement will be very important because without being part of the conversations and trying to make the members of the CCM, I hope by now they know, but you never know, understand the importance of engagement of the TB communities beyond the engagement with the government and the public sector. I am afraid that a lot of the investments in communities and civil society will disappear. The other concern, not concern, the other situation that we need to be mindful of is the fact that everybody is looking and discussing now about transition and sustainability. The countries in your region, several of them, will be seen as, due to their income level, as approaching transition out. For some of them, this GC8 will be probably the last round of funding, which in itself, if the country is prepared, is not a problem, but is very questionable if the countries are prepared for doing this already. And the biggest challenge for these countries will be in securing the funding for civil society or maintaining the funding for civil society and communities. So that is what is coming, but also sustainability. And I urge everybody here to really think about the fact that investments, so every time there is a request for funding going to Global Fund or so on, to have a conversation, is this work going to be sustained beyond this donor money? What we observed dramatically last year was that a lot of things that were constructed couldn't be sustained. And I'm not even speaking of the small funding some of us was giving. I'm speaking of the hundreds of millions investments done by Global Fund or PEPFAR in countries that really were wiped up overnight and left nothing behind. Okay, so nobody should really apply or construct an intervention without having the right conversation about maintaining this funding and maintaining the viability of the interventions beyond the cycle of the funding. From the Stop TB Partnership side, we continue our support to some countries through Challenge Facility due to the contributions from a few donors. We are in discussions and trying to secure some funding from the others. It's a challenge, as you all know very well. We are also are going to support countries to develop GC8 proposals overall. This is not just specific to communities, but overall. The model is slightly different, is basically helping with national consultants, which again is a shift in the way we were working for some countries, but it's a real one because I think countries know better what they need. And also, honestly, we used to do that a lot. By year 26 of existence of Global Fund, I think people know how to write a proposal for this organization. The last thing that I want to say, because I'm at time, is the fact that we have indeed, due to the many tools that we have, a clear opportunity of advancing with ending TB. It's a bit ironic that in these times we are saying that, but it's a reality. And I think the dramatic situation with the funding was also a wake-up call for some of the members of the governments, for some ministers, from some prime ministers, as finally they understand the burden of these diseases in their countries. We should not allow us to get discouraged. I think there is no that word in our vocabulary. I think we have to go ahead. It will not be easy. In addition to the GC8 proposals, countries will be faced even also in this region with funding from US through the MOUs that have very specific terms. And every single donor now, GC, Global Fund, US, Gavi, but I understand about others, are asking very strict terms of co-financing from the countries. And as I said, the governments will be faced with a lot of tough choice to make. Links with them and engagement with them, and in the case of Global Fund with CCMs, will be very important. And it will not be easy for us in TB. Please, in approaching and engaging closer with CCM, if you have any concerns or any difficulties in doing that, please let us know. We decided to bring to attention to the CCM in Geneva any challenge from the TB community in engaging in a dialogue with the CCM in knowing what's happening. So if there are situations in which you want to speak, you want to understand, you want to know more of what's happening, and this is not happening, please let us know. Rachel, thank you very much for being with us, as well as Jennifer and the team, as well as all the others in this very, how to say, difficult, difficult, but also providing us with some opportunities. Thank you very much.
Great. Thank you so much, Luchika, for that really powerful, as always, keynote, and for reminding us that sustained commitment, it's ever so critical at this moment, and for highlighting key issues that for us to look out for forward with GCA. I think more than anything, a deep, deep appreciation for Stop TB and the team's continuing commitment to supporting community and civil society. I think every time I hear Luchika, it's that passion. It's so real, and I think that's what we all lean on as well. So thank you again, Luchika and the whole of Stop TB partnership team. So we will now move on to our next presentation. The next presentation will focus on what to expect in Global Fund Grant Cycle A, including key issues around sustainability, transition in the Asia-Pacific region specifically, and the role of country coordinating mechanism. And on that, it is my great pleasure to invite James Millar from Stop TB Partnership to deliver this presentation. James, the floor is yours.
Thanks so much, Jen. And just for Ken, thanks for sharing. I'm going to jump around these slides a little bit, so sorry in advance. So a big thanks for GFAN Asia Pacific for this discussion and this dialogue, and all of the co-partners, including the regional learning hubs, the global and regional networks working around TB. It's a very timely discussion. I think at the start, I would outline like a little bit of the caveat that given some of the changes that we've witnessed in sort of recent discussions, there's still a lot of unknowns about the upcoming GC8. Countries don't have letters, don't have their envelopes. The guidance from Global Fund was all pulled from their webpage. So right now, there is a great deal of unknowns. So with this, I would look to really focus on what we do know, and it's the context in Asia Pacific and some of the priorities for TB that would be important, and resources for TB that it would be important for TB partners in the region to be aware of. So look, on this first slide, this is just there as a quick reference for you to each be aware. I think we all know the significant number of people who die every year from TB, and the fact that in the Asia Pacific region, you have high burden, some of the world's leading high burden countries, including India, including Indonesia, Pakistan, Philippines, amongst several other high burden countries. So it is something which is a key issue, which needs to be prioritized. And we have seen in the past that in spite of that, and even in spite of having quite, the allocations for TB within the Global Fund country grants, there has maybe been some missed opportunities to really take advantage of some of the opportunities in the TB response. Luchika spoke to some of the new tools, for example, and then from the community side, we have a range of new things around evidence in things like stigma, community-led monitoring, and other areas that can be particularly useful for country TB responses. especially in the context of sustainability and transition, how to embed these within national TB programs, within national strategic plans, to try to have those strong partnerships with governments so that they can continue given that transition context. Next slide, please, Ken. So one of the things that I wanted to bring your attention to on this slide at the bottom, there's a little email address there. It says email address, a web address, dashboards at Stop TB. This is a tool that is available for all of you. It's accessible, and each of you should be aware that it is in place. The data is based on the WHO data, but it's sort of been organized and packaged in a way that's easily accessible. On the screen here, you can see data that's filtered for the high impact Asia countries, Southeast Asia, Western Pacific, and also the Afghanistan and Pakistan countries as part of the regional outlook in your region. But I note you can also filter for your specific countries or a couple of countries. So this is something where you can have access to the best quality data that is available in a way that I think makes it palatable and easy to digest for you. So as you're going into your funding requests, please do use this resource or at least take a look at it. I think it is something that will be really, really useful. I'm not going to, again, go into too much epi on this. It's not an area of my expertise, and it's also something that I think is, outside a little bit of the scope here. But to note, as we said, over 3/4 of the global TB burden sits in the region. Over 50% missing people with TB are in the region. 60% of global deaths from TB are in the region. Close to 40% of missing people with TB HIV are in the region. And then significantly, over 2/3 of drug resistance for TB is in the region. And I note that our friend Leslie was going to join us and is having some connectivity issues, but to say that in addition to a lot of those big high burden countries that I already mentioned, some other countries like Papua New Guinea, for example, have the challenge around DRTB as well. And an even higher percentage when we talk about DRTB missing people sit in the region as well. So it is a critical issue, and just to have that as a snapshot, hopefully this is a tool that can be useful for you when you can sort of undertake a little bit of sort of community engagement, developing your priorities at country level, briefing and advocating to your CCMs, and advocating for the priorities you want to see in your funding request. This is a really good evidence source and one-stop shop for that. Next slide, thanks. Now, again, you can sort of see here as well, just as using this as a resource. I won't speak to it in great detail, but there was a UN high-level meeting on TB. The countries in the region agreed to that political declaration, and on this table, you can again see what the areas and the targets, what the reality is in 2025 and versus the target and the gap. So if we just take a moment to sort of look down the column, which is about the gap between the target and the realities, that you can see that in the region, there is a need to give particular attention to these target areas. And again, I mentioned these because of the fact that they are existing targets, and that might be something that enables you to get the traction with an alliance and partnership with national TB programs and other partners in country to ensure that these get the attention that they need as part of GC8. Next slide, please. Now, one of the things I guess we can sort of see around the question of the barriers to ending TB, and there's I guess a suite, and it's different context by context at subnational level within particular communities. But just to I guess share some of these points that have come up from a bit of a global snapshot, and some of the data, again, another resource which you can use in your GC8 applications based on global community-led monitoring data. Some of those barriers that seem to come out consistently across contexts. Obviously, the funding challenge is huge and it's becoming greater. So there is a particular need that not only are we advocating for these interventions as part of GC8, but advocating for them to be institutionalized, part of national strategic plans, where possible to integrate across broader health responses. And these are something that we need to think strategically about country by country as we head into GC8. But these other areas, the inadequate access to diagnosis and care, noting as well that when we speak to diagnosis, when we speak to treatment, it's not just it's not sort of a purely a binary. There are new tools that are more effective, that are more affordable, that are more accessible, available. They are recommended by WHO. They're available for purchase through platforms like the Global Drug Facility, and we need to make sure that as we're progressing, that we have the types of diagnostics, the types of drugs are, central and part of those national processes. So this is something that it will be important going forward. Noting as well that there's, significant, the stigma is anecdotally has always been a huge issue in TB, as it has been in HIV and other health responses. What we know now in stigma is we have the data from country level assessments from 22 countries, and several of the high burden countries in Asia have gone through this process. And so we have data now which tells us the type of stigma and where it occurs along with people's treatment journey. And this is data which each of you should be using in your GC8 funding requests to make sure that you don't just have some money and some interventions for stigma, but that it's targeted to where that evidence shows you are the biggest amounts of stigma that act as a barrier, that delay people's diagnosis, or that cause people to stop their treatment and so on. And that data is now available. So it's really, really important as you go through the GC8 process that you're very much serving to make sure that there's more nuance on your TB and stigma interventions than you've had before. And secondly, related to this, that again, you look to institutionalize this within your national strategic plans for TB to ensure that funding stigma interventions is something that becomes mainstreamed and normalized given this broader context of transition as well. So two of the other areas, I guess, just to really note here, the TB preventative therapy, like prevention is obviously something that we know that without prevention, we don't end TB. There is an unfortunate tendency, it seems, to under prioritize or deprioritize TB preventative therapy around some of the Global Fund discussions. And this is something that I think is of critical importance for partners and for people affected by TB in Asia Pacific to be aware of, making sure that we're not sort of sacrificing the prevention side of our TB responses given the budget allocations or the budgetary challenges. And again, to look to integrate these international strategic plans. In many countries, it is there, but to make sure that the corresponding budget is available so that this is institutionalized going forward. But really wanted to flag that TB preventative therapy piece as well. Obviously of critical importance for people living with HIV as well. So something where there's a clear shared interest with HIV communities who can help take this forward together jointly as part of GC8. The last, looking at DRTB, and there's DRTB on the slide previous. I talked to some of the percentages of people with drug-resistant TB in Asia Pacific and the number of people missed in Asia Pacific with DRTB. So this is a priority. It's something where in recent years we have new tools available, and this is the thing that I think is really important. There are new tools available for DRTB, and this needs to be something that we ensure is included and has enhanced attention. One of the ways in which there is a need to kind of address this or to take this forward a little bit is certainly, I think, to make sure that there's an increased community role in the DRTB response, and efforts are made to really increase the role that communities play in this area. DRTB has been highly biomedical for a long time, and elements of that will remain the case. But there is a critical role that communities can play in terms of generating demand for these new DRTB tools, to demystify DRTB tools, to know, to play that role as peer supporter, so that people with DRTB know that they can be treated effectively for this. And so this is something, again, that I wanted to sort of bring attention to. I note that that Luchika mentioned Challenge Facility for Civil Society across several countries in the region, and I talk to this on the next slide, but to say that there's a particular focus around DRTB going forward, and that's with the support of UNITAID and the initiative that we have this increased focus on this important and often neglected area of the TB response. Next slide, please. So again, I just touch on this briefly. We've spoken to funding and the significant gap. Obviously, the funding allocation discussion has moved on. Unfortunately, it still remains where 18% of global fund allocations are for TB, recognizing that in some countries in Asia, that is a higher share, and that's good. But irrespective of this, it will be really important for you to be aware that CCMs can revisit the funding allocation, and given the current environment, it will be really important to explore whether there are opportunities to get a more equitable share for TB, so that it can ensure that TB services can be scaled to the level that they need to be. There is precedent for this. Countries like South Africa, for example, their CCM did a significant revision of the allocation to increase shares for TB, so that critical gap can be addressed in part. Stop TB has done some work with a lot of country partners recently about CCMs and understanding, I guess, areas of representation and impact. In the next week or so, there will be a report that is released looking at the way in which TB is represented and impacts through CCM discussions. Not surprisingly, I think it's that TB is largely underrepresented, it's underfunded, and there's been like the impact corresponds to that lack of representation. So there is an important moment in time, I guess, as community partners working in TB, as we head into GC8, where there's an enhanced role for country coordinating mechanisms, to really make sure that we're holding them to account, to make sure that we're engaging and building those partnerships, but holding to account. Because it's not, so if we're going to put increased trust in CCMs, increased responsibility on CCMs, and reduce the broader role for communities to engage and participate in country dialogues, which is the case for GC8, then there is a need for that accountability element. And so really wanted to bring that to people's attention as we head into GC8 as well. Moving on to the next slide, please. Now, in terms of Challenge Facility for Civil Society, it's currently been working across 4 different pillars. And I mention this because this is Stop TB is developing some guidance around community interventions and engagement for GC8. We note that it hasn't been released yet, largely because there's still we need to see what comes out in terms of global funds guidance, its allocation letter, and these sorts of things, to make sure that what we can produce is tailored in response to that, to ensure that there can be effective engagement. But these 4 pillars will feature in there around how to engage in interventions that are priorities. The first one is very much looking at reducing stigma and structural barriers. As I said already, there is new evidence on stigma that we never had before. So there's a big opportunity to really have some targeted interventions to respond to that evidence, to target where stigma manifests at certain points across a TB journey, to really respond to people having delayed diagnosis, or interruptions on treatment. A second one is certainly looking at closing the gaps on TB, on detection and prevention and treatment. And it's about this demand creation element. And it's certainly, the importance of communities having a voice around the types of drugs and diagnostics that are available, and making sure that they are available in the places where people access them. This idea of people-centered care is very much central to this, but those points around TB preventative therapy and DRTB tools are certainly a key part of this. Third, community-led monitoring. There's over 35 countries and 400,000 people using TB1 Impact as a community-led monitoring platform globally. There are other platforms as well, which is fantastic, but they're just to recognize that there is now, a very good evidence base around community-led monitoring, and this data will be important going to inform GC8, but to be included in GC8, making sure community-led monitoring and accountability pieces are included as part of what is funded from community-led initiatives. And then the final one, certainly looking at the investments in TB affected community and community systems with a specific focus on integration and on sustainability. And as we've mentioned in the region, that's going to be key, making sure that this GC8 is used even more so than the past to build that institutional capacity, that community system, the partnerships to institutionalize community priority interventions so that they can continue in spite of that context of transition going forward. Next slide, please. So I mentioned the Challenge Facility for Civil Society, just so that people are aware. There's 11 grantees in Asia Pacific. It was close to 50, I guess, in round 12, and that's a reflection of some of the changes in context. But as Ruchika mentioned, we're working with a number of partners and really hope to see that to be a new round going forward where this significantly increases. As we know, and I note that Aman, on behalf of TB People, will speak a little bit to a campaign that TB People has been leading, which looks at the important needs to have countries using their set-asides to fund TB communities. We can see that we know Challenge Facility has been this mechanism that has built something strong, impactful, and there is a need to make sure that TB communities are continuing to be funded going forward. Right now, that is a huge risk and a huge threat, but I'll let Aman speak a little bit more to that in his slides. But just so that people are aware, in addition to having a number of grantees in India and in Pakistan, there's also grantees in Vietnam, in Cambodia, a regional level grant which is linked to ACT Asia Pacific, and some further sort of sub-grantee work which is also supporting TB survivors in Philippines, amongst some other countries as well. So again, just so people are aware, if you have grantees in your country, they would be fantastic allies for you as part of the GC8 processes in your country. Next slide, please. So a number of community asks going forward. It's obviously about information access, and this is even more relevant than in past rounds, given that there's so many uncertainties, so many delays, and that the process is going to be so compacted. So it's just critical that you continue to ask your CCM, your fund, your PRs, your SRs, your Global Fund country teams for the information, making sure it's updated. Share it with your national TB programs because they're also awaiting that sort of information, and make sure that there's a real opportunity for effective engagement. That second one is that effective engagement. It's critical that you have that information, that you're able to disseminate it across TB partners in your country, to also reach out to communities affected by HIV, by malaria, to find those shared priorities, to ensure that that community priorities do not fall from inclusion, I guess, in the country grants. To make sure that, in particular, just to bring your attention, you need to keep engaged to know when the letter from Global Fund with the allocation goes to the countries, goes to the CCMs, to be aware of that and to share it widely, to organize, I guess, a TB-focused discussion so that you can develop a set of TB priorities, and to make sure once you have that you're sharing it back with other communities across other diseases, the CCMs and the country teams. Looking forward, as I mentioned, that there will be opportunities here to build off past investments, but given the budget constraints, that will be a challenge. And so it will be really important for you to use the evidence that is available. And I note for some of those community priorities, for CLM, for stigma, we have evidence that we didn't have available previously. For underserved populations as well. And this is something that would be really important for you to be aware of and to be using in those discussions as well. Next slide. So two of those resources again, I mentioned at the start, you have the dashboards for community. And then secondly, there's two more here. There's a stigma portal, which you can access, which shows you that stigma data, and a One Impact country dashboards and a global dashboard. Again, just some resources for you to be aware of while we still await the further guidance from Global Fund, that you have these TB resources that will be invaluable for you as TB communities heading into GC8. Again, you can look at both of these as global trends, but you can also see specifics about country journey, journey along a TB journey, and then to see country specifics as well. Next slide. So with that, I wanted to just really thank everybody for the time and just as one final, I guess, request and call for the TB community in Asia Pacific at your countries at regional level. We're just 2 weeks away from World TB Day. Led by countries, powered by communities, or however you adapt the slogan. I'll put in the chat the communications toolkit, but just a big request that you can use. You engage at country level for World TB Day. You sort of help to use the social media toolkit to disseminate that widely. And I guess that there's a big opportunity as well to make that connection between World TB Day, between the challenges of sustainability and transition, and to ensure really effective engagement in GC8 to help overcome some of those. So thank you for the opportunity. Happy to answer questions. Back to you, Jen.
Great. Thank you so much, James, for that really comprehensive, insightful presentation. Really appreciating the very practical and concrete recommendations and for highlighting the availability of new data and for us to make sure that we utilize the data to really help us make the case for TB, whether that's for equitable funding for TB, for the program that we need, or for the investment in the community that we need going forward. On that note, just to also acknowledge that we will be sharing the slides, and the slides will be available on GFAN AP website following the webinar in a couple of weeks' time. So in case anybody would like to have a further detailed look of James's presentations, that will be available. So we will now open the floor for questions and discussion. And I believe... okay. So anybody, if you have any question, please do feel free to raise your hand. And we will call on you, or feel free to drop your questions in the chat for James specifically, if there's any questions. James, I think your presentation was so comprehensive and clear. I don't see anyone having any question. Rachel. Hi, Rachel, go ahead.
I don't have a question, but I do want to raise that there was a chat question asking when would the allocation letters be expected to be sent out. I do want to acknowledge we do have colleagues also and friends also from the Gold Fund Secretariat that might be able to share some information or would like to make some comments around the presentations or introduce themselves. So I'd like to use this opportunity also to say that. Or James, would you want to be able to answer that question? Thanks.
Thanks, Rachel. Let me see if there's another question before I invite James to respond, or somebody from the Google Fund familiar with that. Okay, so James, might you like to respond to that?
Yeah, so I think I think the Global Fund colleagues would be better placed and have more information, but what I've heard secondhand is that they're coming soon, in inverted commas. So I think that there's still a little bit of uncertainty exactly when, but maybe Global Fund have more can provide those specifics. It is important, I suppose, that noting when it does come to make sure and to be advocating for not just understanding what's in there, but to recognize that the communities do need time to unpack it, to strategize and to prepare. And I think that that's also something that's going to be important. So the later the letter comes, also that needs to be recognized into the process that happens at country level to ensure that that community, that participation and involvement is meaningful and strategic and sets up to be impactful. Thanks, James.
Great, thank you so much, James. I do not see any other questions at this point. So if anybody would think of anything that they would like to check with James, please feel free to drop in the chat box. But for now, we will now move on to our next presentation. In this session, this next presentation will cover outcomes of the 8th replenishment, decisions on country allocation and catalytic investment, and what these mean for communities and civil society. And on that note, let me invite.
So I will just really speak around some of the key decisions from the board meeting that just happened recently that have resulted in the reduction of your allocations. I think that would impact a lot more countries in our region than in other regions more specifically. Can next slide, please. So before I start, just to let everybody know, the Global Fund Advocates Network Asia Pacific is an advocacy platform of HIV, tuberculosis, and malaria community and civil society organizations in the Asia Pacific region. Very notably and stressing that we're an advocacy platform and we are able to do the work that we do because of your efforts. We support advocacy for a fully resourced global fund to fight AIDS, tuberculosis, and malaria, increased and sustainable domestic resource mobilization for health, and equitable, people-centered, human rights-based, and gender transformative inclusion of TB, tuberculosis, and malaria, of HIV, TB, and malaria responses within UHC. So I will be speaking to three things during this presentation, which would be the outcomes of the 8th replenishment, the sources and uses of funds for the 2026 to 2028 allocation, GC8, and catalytic investments for 2026 to 2028. Okay, give me a second. I'm trying to figure out if I want to move to the next slide yet. Sorry. Okay, next. Yes, this slide, please. So you would see on this picture that this was the picture that was taken at the end of the 8th replenishment pledging summit that happened in South Africa in November last year, November 21st. This is the first time that a replenishment pledging meeting is co-hosted by a implementing and donor country, and namely this was South Africa and the UK, and it helped because to a certain extent they leveraged the G7 and G20 processes. However, we need to note that even though we did raise 11.34 billion at this pledging summit, which is not the final figure because this is the number that was gathered in November last year, the replenishment, and even now as we're living, it took place during an extremely complex political and economic context with high political volatility and shifting priorities. And noting that, as Luchika mentioned in her keynote address just now, that there were many different competing priorities and replenishments taking place at the same time, such as Gavi. So there was 11.34 billion raised in Johannesburg, which 1.34 billion was raised from private sector and philanthropic partners. At that point, there were many major donors, traditional donors that hadn't pledged yet, like France, Japan, and EC. Next slide, please. So up to date, as of the end of February, we have $12.6 billion pledged. There were some announcements made after the pledging summit. There was a 39 billion from Saudi Arabia that was very, very public, but very disappointingly, we received only 515.7 million from Japan. I'm using only because it's a drastic drop. It's over 50% from the 7th replenishment that we received from Japan. And at this point, there are some factors that haven't been considered or public announcements that have been made so far, including France, EC. From our region, Indonesia still hasn't pledged. But we do note that there have been some efforts from our partners, specifically from India, from our South Korean colleagues, that have sustained commitments from donors, even if they have not been able to step up. So notably, India did step up, and South Korea did manage to maintain the pledge, even though they've had a reduction in their ODA budget. So there is a lot of ongoing work that is still needed for post-replenishment pledges. So for countries to top up, as well as to work on them being able to put the money in the bank, pledge conversions in the coming years. Next slide, please. So this is a complicated slide. It's a decision point that was taken from the last board meeting that decided that was that how much money was raised and then how much money would be able to be allocated to countries. So I'm not going to go too much into this, but from this number, you would then actually derive that there will be 12.6 billion that was pledged finally. And then that for country allocations, there's 10.8 billion. I will go to the catalytic investment slide first. The next one, please. That will give you a little bit more, give more insight. So 10.8 billion was derived from after reductions to OPEX and other expenses. And this is actually 9% lower than GC7 after reprioritization. But for catalytic investments, it is an increase. There was so out of the 10.8, out of the 12.6 billion, 774 million is available for catalytic investments. This slide doesn't give you the numbers because that the board papers that have been updated haven't been shared publicly yet. So just to note that the board approved 260 million for catalytic investments and 530 million in earmarked funding from private donors was added to get the total of 774 million for catalytic investments. Catalytic investments include things such as the next gen market shaping and response, emergency funds, addressing human rights and gender barriers, build community networks and engagement, which also includes supporting sustainability and transitioning, optimizing RSSH and climate and health. So more specifically, there is US 70 million that's used, that is allocated in catalytic investments for addressing human rights and gender barriers. Next slide, please. So what do we do in terms of unpacking the information? So for country allocations, this basically means that although it is 9% lower than GC7 after reprioritization, for country allocations, it is 70% decrease from this last cycle. Even though we see a 9% increase from catalytic investments from the last cycle, there is accelerated transitioning. There's less funding, which will bring changes. With reduced resources, many countries will be facing accelerated transition, or what I am very concerned about, accelerated transitioning. So while there's no official list that has been released for some countries, GC8 might be expected to be their final grant. So I will emphasize that there is hugely reduced resources expected in the Asia-Pacific region for communities and civil society. And James has mentioned how we need to actually fight to ensure that in terms of the conversations that will be happening on this at the CCMs, that you will be able to engage more effectively and to be able to shift the discussions as much as you need. This is where I will stop the presentation. Next slide, please, and the final slide. I think what GFAN Asia Pacific really appreciates is all your commitments and for all the partners that we've been working with over the years in terms of our replenishment campaigns, the thank you letters. We wouldn't be able to do so without you. So a huge thank you and a huge shout out to all of you. And for others that haven't engaged in some of the resource mobilization work that we have, we welcome you to reach out to us on our website, on LinkedIn, etc. Please get in touch with us over the Zoom call. We'd be very happy to engage and work with you as much as possible. So over to you, Jen.
Thank you, Rachel. I think that's a perfect transition For us to continue this sharing from GFAN AP, I want to invite our colleague, Ken Koo, who's the communication officer at GFAN AP, to share a short advocacy videos that GFAN AP and partners have prepared. So Ken, maybe you can give a little bit of a background. Over to you. Yeah, thanks.
Thanks, Jen. Hi, everyone. Glad to be here today. And I just wanted to, I'm very excited to share this video. Hopefully some of you will have seen it. Many of you here would have been part of the speakers or part of the contributors to this video. But we will be watching this video with the full version very shortly. But before that, I wanted to give a quick overview about the background and the objectives of this video, which was produced over the past few months with a lot of collaboration and a lot of support from our partners. So we as we have heard in this webinar, we know that TB is the deadliest infectious disease, and we know that the Asia Pacific region bears a huge bulk of the world's TB burden. So this video was created to really highlight the collective partnership and the parties that are necessary to achieve the elimination of TB globally, as well as the important roles of all the stakeholders in this process. And especially, we wanted to highlight voices from the communities and civil society. We wanted to showcase through this video, as you will see, really the leadership, the ownership, and the determination to fight TB. And we also wanted to highlight key asks as well as impact outcomes in the context of the evolving global health financing landscape, as well as the important role of the Global Fund in partnership with Stop TB, as well as communities towards achieving these targets of ending TB. So in this video, we were took a lot of care to really acknowledge the diversity of lived experiences of people with TB, as well as emerging challenges and the many different ways that our colleagues are contributing to the fight. And we really hope that this video, which actually has already been soft launched, it was soft launched last November in the Union Conference in Copenhagen, thanks to Blessy, who is the chair of the GFAN AP Steering Committee. Blessy brought it there, and we really hope that this video in its full version or in excerpts will be used as a powerful advocacy tool during this critical time to really drive home the key messages that need to be communicated and need to be said to the stakeholders and to the decision makers out there. And lastly, before we watch the video, I also want to just appreciate the speakers, the partners, our colleagues in country who helped in the production of this video. We have Stop TB Partnership, GCTA, TB People, and ACT AP, who are our partners in creating this video. We have our 8 speakers who you will see in the video who each contributed their perspectives. And we also have many colleagues across the Asia Pacific who helped with the localization of the video by providing subtitles in 8 different languages. So all this effort has culminated in this video, just about 6 minutes plus, and we'll be watching it together. Before that, I am mindful that there may be issues with bandwidth, and therefore there may be a lag, in which case I am just about to share in the chat the link to the video on YouTube, which I urge you to click and watch as we're watching here in case there is a lag for you. You have this other link that you can watch it at. Also noting that if you require the multilingual subtitles, it is in 8 different languages. You can select that on your end under the settings in the YouTube link.
Because of my TB diagnosis, I was told that I was a danger to my baby and to others. That was one of the hardest moments of my life. In 2011, I was diagnosed with MDR-TB, a type of TB resistant to most drugs and harder to cure. But thanks to the Global Fund partnership, today my children and I are alive and healthy. With support of Challenge Facility for Civil Society, which received funding from the Global Fund, I am a TB survivor organization in Indonesia and advocate for better gender-inclusive care for people with TB. And I believe that, yes, we can end TB.
The good news is that since 2000, global efforts towards ending TB have saved 79 million lives. The bad news is that this progress towards TB elimination is now under immense threat because of global funding cuts on programs that diagnose, prevent, and treat TB, and other crucial programs that fund communities that support this service delivery through mechanisms like Challenge Facility for Civil Society. The global resurgence of TB is extremely concerning. TB is a disease that knows no borders, and the epidemic on our hands is a growing threat to our collective security, well-being, and prosperity. Global partnerships such as the Global Fund and the Stop TB Partnership have a critical role to play in the fight against TB by mobilizing resources, technical expertise, political will, and community leadership to deliver essential TB health responses where they matter the most.
Today, the heaviest TB burdens fall on the world's poorest and most vulnerable. Over 80% of TB cases and deaths affecting the most marginalized people in low and middle income countries. In Papua New Guinea and across the world, the Global Fund is investing in the delivery of truly equitable, sustainable, and cost-effective TB interventions, which is only possible when communities are funded and placed at the heart of the health response.
Unfortunately, stigma, fear, and high cost of medications associated with TB remains a major barrier that prevents people affected by TB from seeking treatment in formal healthcare settings. For the first time in Pakistan and across the region, we have evidence documenting these barriers through the stigma assessments supported by Challenge Facility for Civil Society. TB responses must also prioritize the economic inclusion and empowerment of communities affected by TB to ensure their economic, social, and cultural rights are protected. That's why investing in community systems and community-based organizations are a critical component to ensure effective TB responses that are impactful, cost-effective, and accessible for all.
This is our call to action. Support the fully resourced Global Fund 8 replenishment with an investment of $18 billion to ensure the continuation of essential HIV, TB, and malaria services and save up to 23 million lives.
Mobilize increased domestic resources to scale up TB prevention, screening, diagnosis, treatment, and care services, as well as increase funding for research and development
to support innovations in diagnostics, drugs, and vaccines.
Strengthen health and community systems in collaboration with communities, civil society, and technical partners to provide high-quality TB care, accelerate towards UHC, and enhance preparedness against pandemics and drug resistance.
Thank you for joining us for essentially the launch of the video. This video will be shared in the coming weeks on our platforms and our social media, leading up to World TB Day. And we really urge you to help us amplify our messaging by resharing, reposting the comms that will be coming soon. Thank you so much. And back to you, Jen.
Great. Thank you so much, Ken. And thanks again. As Ken said, GFAN AP and partners were extremely proud of this video. And so do help us amplify community voices on TB by sharing this video with all your network and all the key stakeholders. On that note, I'd like to next invite Aman Shukla from Unite Global to help us continue this conversation about community engagement and about holding the line communities defending TB gains. So Aman, over to you. Thank you.
Thank you so much, Jennifer. So I think, yeah. Hello, everyone. Good morning, good afternoon from wherever you're joining. My name is Aman Shukla from Unite Global, and today I have the honor of speaking on behalf of TB People Global and the TB community worldwide. Olia was originally scheduled to join this webinar, but due to her travel and connectivity challenges, she has asked me to share the reflection on the behalf of the community. You can see on the screen, this is a survey that we did among the TB community. Communities of people affected by TB have been working for many years alongside government, healthcare system, and global partners to strengthen the TB response. But community networks support people through, diagnosis, treatment, help to reduce stigma and discrimination, collect data about the barriers to care, and ensure that programs respond to the real needs of the community that they want. But today, in many of these programs, we are facing some uncertainty. And the data on this slide illustrates why. The significant proportion of TB community organization receiving very limited global fund related funding each year. Many networks received less than 25,000 US dollar annually. And for many organizations, global funding is not applicable at all. You can see in the picture how the percentage of the organization that are not applicable. This creates several structural challenges. The structures that we see is first that TB survivor network receive significantly less funding compared to other disease responses. Second, TB community organization often face complex and lengthy processes in order to access global fund support, because smaller organizations frequently lack the administrative capacity required to navigate these systems. And for that, I think this will be something that it provides community to access funding directly. Third, I think short-term funding cycle threatens the sustainability of the program that rely on long-term trust with the communities. Because what I believe is that, funders and the partnerships that are there, they are going to fund in the communities for some period of time, and they will come and they will go, but the communities are going to be there forever. Fourth thing is communities still have limited influence on decision-making spaces, even though their experience is essential to understanding the barriers people face. Since morning, we have seen that there are so many people who have talked about CCM representation. There are so many people who have talked about GC8 process and the community's involvement into that. And still, we face some of the other barriers to involve communities meaningfully. And finally, funding level often do not reflect the real burden of TB or the diversity of communities that are affected. This is exactly why mechanisms such as challenge facility for civil society has been so important for the community, because CFCS has been the only mechanism that provides the support to the communities directly. TB community networks globally at the local level, regional level, and at the national level, because you saw that in the presentation when James also shared that there are so many communities network that have been developed and supported initially from the CFCS grantee. Because of the limited accessibility of direct funding, TB people and the partner strongly support the continuation and strengthening of CFCS as a critical mechanism that enables community-led action. At the same time, communities around the world, we are calling for a strong support for the Global Fund. You can see the QR code on the slide, and we warmly invite everyone participating in this webinar to scan the QR code and sign the petition in solidarity with the TB communities. While the presentation continues, it only takes a movement. More than 70 organizations and over 11,000 individuals worldwide have already joined this call to the Global Fund Board. The petition called for strong support for Global Fund replenishment and for a continued commitment from key donor countries like Australia, France, and Canada. Because ending TB is not only a medical challenge, it is also a question of whether communities are empowered and resourced to act. Medicines can cure tuberculosis, but without trust, information, community support, many people will never reach to those medicines. And for that, you need this. Communities are not asking for charity, but communities are asking for the resources that need to continue saving lives. That is why your solidarity today, even though a simple action like signing the petition matters. Together, we can ensure that voices of people affected by TB remains visible, heard, and supported. And I think after this webinar, if you want, I can also share the link of this petition so that it can be helpful for you to sign and support this. Thank you. Over to you, Jennifer.
Great. Thank you so much, Evan, for that really powerful voice and then for sharing community perspective. I'd like to the next transition and hand the floor over to Atu from GCTA to help us lead this next plenary discussion on priorities and areas of collaboration. Atu, over to you.
Thank you so much, Jennifer. And thank you for all the insightful presentations and perspectives shared so far. And now we will move to the plenary sharing and discussion on priorities and the areas for collaborations among civil societies and communities across Asia Pacific. In this segment, I would invite each organization to share 3 key points. They may be priorities and/or challenges they see in the coming future. And we would particularly welcome reflection. So maybe 1 or 2 reflections in the very end, if time permits, on what is needed to sustain community-led response and strengthening resource mobilization globally and domestically. To ensure everyone has the opportunity to contribute, I kindly ask the speakers to limit their points to 2 minutes only and focus on 3 key points. With that, I would like to begin with inviting Blessina Kumar from GCTA to share her 3 key points. Thank you.
Thank you very much, Atul, and thank you, GFAN colleagues, for this great webinar so far. So coming to the point, I'm actually at a conducting the Northeast India point of care diagnostics for TB, HIV, and Hep C communities in Shillong. And today is the second day, and over, what we are hearing is two main challenges: stigma and lack of awareness. So I want to base that behind everything we talk about. So priorities for GCTA globally, it has to be all about people. It has to be about communities. And this means that communities are at the center of the TB response. Not just at the center, that communities lead the TB response. You know, there is a big mismatch. One of the biggest challenges is mismatch between what we are identifying as the challenges. You know, over and over again, we are hearing stigma is the biggest challenge. Lack of awareness is the biggest challenge. What is our response? More AI tools. Yes, AI tools are needed, but if communities' capacities are not built, when those tools are available, they are not going to be rolled out in a way that will benefit everybody. So first of all, matching the priorities, the challenges to our response is very, very important, irrespective of what mechanisms we use. So G2G is what I say, guidelines and policies to the ground. Very, very important. Are we hearing people? Are we listening to people is extremely important. And yeah, and also just one point about CCMs. CCMs are not where they need to be. TB is underrepresented. TB does not have a voice in many of the countries in our region. So I think it is for us to collectively think about how we are going to change this. I think it's very important for us to deliberate, whether it is on webinars or online, but I think really we need to get to grips with the challenges so that we make a difference. No amount of new technology will help if communities remain behind, if stigma stops us from accessing services, if we don't have awareness and understanding what TB is. So on this World TB Day, let's commit to eradicating TB, to ensuring capacity of communities is built in understanding TB. Thank you.
Thank you so much for being so concise and now and your reflection. Now I would like to invite Leslie from PNG for representing ACT AP to share his perspective. Thank you.
Good afternoon, all. Can you hear me?
Yes, please go ahead.
Okay. So, good afternoon, all. My name is Leslie Bola, and I'm the Executive Director for KPAC, and I'm also a member of the Activist Coalition on TB Asia Pacific. There are 30 members, individuals who are part of the coalition in 15 countries in Asia Pacific. And this is a very influential platform. We've developed tools and we have written down commitments that will help all our leaders advocate at the high level, especially at the high level, and also at their own countries. I really want to emphasize on the commitments that all of us came together a couple of times and we've made it, and it's very useful tools for us to use, especially when we are targeting our politicians, administrators, policymakers in our respective countries. It's very crucial because this is a very laid down commitments that each and every one of us are committed to, so that we can help reduce TB in Asia Pacific. I just want to share some statistics. As we all know, TB still remains, as others have said, remains a major health threat. TB is one of the leading infectious killers in Asia Pacific. In Asia Pacific, we account for 63% of global TB cases. That's more than half. So in fact, we should be leading the response, including our government, our communities, to reduce this. So that's a big issue in Asia Pacific. As James mentioned earlier on, we in Papua New Guinea, we have a high loss to follow-up cases in the world. 20% of patients do not complete treatment. And we have lots of issues around this. And in Papua New Guinea, one of the response we're doing is to really emphasize on community-led monitoring. This is one of the ways where communities who are voiceless can really share their voices through community-led monitoring. And I would encourage all of us here, when we're putting in the grant application, to really emphasize that one of the ways where community can really play a very big part is being part of a community-led monitoring, where we monitor services that come into our communities. And if we need improvement, we need to stand together to fight for quality of service for us. Also, I want to emphasize on survivors. We really need to emphasize on our groups, strengthen our groups so that our network, so that they can help. As our other friend has said, our communities are the center of the response, and if they help, we help with our service, they actually help reduce stigma and discrimination. It improves treatment as well. So
Thank you,
this is some
Leslie.
of the- yeah.
Sorry, sorry for interrupting. Thank you for those points. And I'm really sorry, but in the interest of time, I will
Sure.
have to move us to the next speaker.
Okay,
And
thank
I
you.
invite Aman Shukla from Unite to share his perspectives and points. Thank you.
Thank you.
Thank you so much, Atul, for the opportunity. I think everyone is speaking about highest burden in Asia Pacific. Yes, it's true that, Asia Pacific region contributes nearly 50%, of the global TB burden. And this is a region of young people also. Unfortunately, many young people remain disproportionately vulnerable to TB due to social inequalities, limited access to services, stigma, gap in awareness and prevention. As the Global Fund moves towards the eighth replenishment, it is critical that Asia Pacific region is prioritized and the young people are recognized not as a beneficiary or attendee or participant in the GC8, or CCM, but as a key partner. And as Blessy also said that, Madam said that even TB people those who are with the TB or representing or working in TB does not have a good representation in the CCM. Even at the grant level, making process level also, we don't see anybody with a strong voice representing TB community. I think prioritizing that is also very much important. I will like to highlight key three priorities that Global Fund and countries should consider is that ensuring meaningful representation of youth in CCM and GC8 planning. Government and country coordination CCM mechanism should actively include youth representative in grant designing, priority setting, and monitoring process. So they are involved in each and every steps of the GC8, and then they can actively, meaningfully engage. And then young people will ensure that, TB program reflects the reality and need of the affected communities. And then second thing is strengthening the financing for community and youth-led responses. As we all know that there are not a lot of work that has been done around young people in TB. In other diseases, you will see millions of work, funding flowing away. A lot of work has been done, but dedicated resources for the TB community, especially for young people, is not allocated. Not for youth network and community-led organization, but at the forefront for the TB awareness, prevention, stigma reduction, and treatment support, you need young people's involvement, and their dynamic and passion with the work will kind of bring an impact into the response. Then third thing is to sustain the support for community engagement mechanism. like everyone said in this call also, and emphasized the importance of CFCS initiative that has enabled civil society, youth participation in global fund processes, such as CFCS mechanism must be protected and strengthened. Otherwise it will be a big problem for the TB community, not only for youth-led networks, but overall in general, we see there is no dedicated support for the community. If these things enables and strengthened, then maybe there will be some hope to end TB by 2030. Otherwise, I don't see anything. In the closing, I just want to say that young people are not just the future of the TB response. We are already leading change today, and strengthening youth engagement in GC8 will ensure that TB response remain community driven, innovative, sustainable, and bringing us as a community to share our shared goal to ending TB.
Thank you. Thank you, Aman, for your points. Finally, I would like to invite Chinmay Kumar from Asia Pacific Regional Learning Hub to share their perspective and points. Thank you.
Thank you, Atul. As the Learning Hub, I will be sharing the priorities which are mainly we are looking forward to when it comes to Grand Cycle 8. And as Asia Pacific TB response have faced a lot of reduced allocation challenges, and there is one message clear for GC8 that we should not work in silos, and we will be having an holistic approach moving forward. For this situation, it's very important for the communities that there is an urgent requirement of technical literacy for the communities, and to bridge this gap, we under the Learning Hub, we are deploying technical expertise and providing a lot of technical knowledge to communities by newsletters, as well as technical briefings, which is very much focused on Grand Cycle 8 to design and empower communities to understand and implement at the country level, moving communities not into the separate room, and making sure that they are at the center of grant making. Secondly, we also need to make sure that during this current time, we urge communities and CSOs to start discussions with CCMs now on domestic financing for treatment and diagnostic. The time is limited, and it's now the community who have to take approach in terms of reaching out to CCMs and ask them questions, ask them about about the way forward for the communities. And not just that, Learning Hub is also a communication lifeline for communities, because we share the Global Fund real-time information coming from Global Fund through our dedicated channels, and ensure that latest information are reach towards the communities, so that communities can negotiate when it comes to their part in the national processes. And finally, we must use CLM as our one of the very important tool to advocate. Learning Hub acts as a bridge between the grassroots and the Global Fund, because we amplify all the real challenges coming from grassroots to the Global Fund, and make sure that whatever experiences and challenges communities are facing are well informed to the Global Fund as well. And apart from that, Learning Hub also provides opportunities for community engagement in Grand Cycle 8 through small grants and short-term technical assistance for community dialogues at the national level, and to prepare them well for the Grand Cycle 8. Please reach out to us for more information on GC8, and let's ensure that GC8 is a cycle of reliance and not just a collapse. Thank you so much, Atul. Over to you.
Thank you so much to all our panelists. But as we know, we want to know more. And there is this one question I actually want to ask all our panelists, and I would want one response because of the time constraint, very concise, to the point, actionable. If we want to truly sustain the gains made in the TB response, what political or financing shifts are most urgently needed from governments, donors, and global partners to ensure that community-led responses remain adequately funded and supported over the next 3 years? One quick response from our panelists, and then we see a hand up, so we'll ask the participant also to share their thoughts.
Thanks, Atul. Can I go?
Yes, please.
Yeah. So I think, like we have.
I think she's having network issues. If anybody else from the panelists would like to answer, and then we can move on.
I think from me, one of my goals is for all of us. At this situation, there's a big need, financial need for all of us. We need to collectively work together and advocate as one big group to influential people out there. So a collective effort for all of us to build up our financial finance for the prevention programs and treatment.
Thank you so much, Leslie. And in the interest of time, I will now hand it back to Rachel, and then for her closing remarks. Thank you so much.
Hi, Rachel, over to you. Go ahead.
Great, thank you so much, Jen. I think that was a really, really tough question. Maybe we could have asked Ruchika to actually address that as part of a keynote address. But I think this webinar was actually conceived with the idea that it's not just about GC8, because a lot of questions around country ownership, around what that means, the communities and civil society's role in these conversations have been really amplified over the years. So it's really important to note that in our region with the highest TB burdens, it's actually more than 50%, with Indonesia, Philippines, and Bangladesh, India, etc. going forward. It's actually our responsibility collectively to actually hold our governments responsible. While we can rely on donor aid, we have seen with the USAID withdrawals that it has huge impacts on our countries and on our advocacy and our program implementation. So it's really, really important for us to work collectively together to ensure that we are holding our governments responsible. We are working on sustainable financing in our countries, making sure that our countries actually have collected enough taxes to make sure that they are able to finance their own health responses, and also to hold donors accountable to make sure that they are able to meet their commitments in terms of their ODA commitments. So I think, thank you all. We hope to be able to continue this discussion, and perhaps we could arrange for another relevant call to be able to strategize more concretely moving forward together collectively in terms of what that means, not only around GC8, but also to be able to be more forward thinking, to be able to make sure that we are able to plan 5 years down the road and not be reactive to a lot of the situations that we're facing right now. So thank you everyone for joining us today and being part of this webinar. We really thank all our partners and all of you for taking time out of your busy schedules to participate, listen, and share in this discussion. I want to extend our sincere thanks to all our speakers and panelists for their valuable insights and for sharing their knowledge, and for you for engaging very actively as participants in the discussions. I want to take this opportunity also to very, very much thank Ken. Ken Koo, who is our communications officer. This is his last webinar with us. We are all facing financial constraints, and very, very sadly, we've had to make the decision of letting him go. But I hope this is not going to be for an extended period of time. Ken, I'll be in touch with you shortly. But we really, really appreciate your support over the last 2 years. You've been very indispensable in terms of your work and your commitment to the cause. So we hope this session has been able to provide you useful insights and practical takeaways. As Jen has noted, the blog post will be up very shortly with all the presentations, but please feel free to be in touch with all of us. In terms of questions, you can identify the speakers in the chat box that you would like to get in touch with. Please reach out. We hope as GFN-AP that we are able to connect partners, support you in the work that you are doing as much as possible. So we'll bring this to a close, and on behalf of the entire team and all the co-organizers, we thank you again for joining us. Have a wonderful weekend. Thank you. Bye-bye.
Thank you so much.
Bye, everybody. Thank you.
Bye.
Bye-bye. Wonderful.